Hi, my name is Dr. Bushera Choudry and I'm a GP. I'd like to encourage you to take part in the NHS Cervical Cancer Screening programme. These tests involve detecting cervical cancer before people get any symptoms. This makes it easy to treat and can help save your life. The screening is offered to women or anyone with a cervix aged between 25 and 64. You'll be sent an invite by post every 3 years between the ages of 25 and 50, and every 5 years between the ages of 50 and 64. It's important to book your appointment as soon as you get your letter, and if you haven't received an invite, contact your GP surgery. The test itself should take less than 5 minutes, done by a female nurse. The nurse will use a tool called a speculum, which will be inserted into the vagina using a small amount of lubricant. This will allow the nurse to see the cervix and take a small sample of cells using a soft brush before removing the speculum. If at any point you are uncomfortable, you can let the nurse know and she will stop. The sample will then be sent to the lab to check for the human papillomavirus, HPV for short. This is because nearly all cancers are caused by the HPV virus. The results will be sent to you by post. If you do test positive for the HPV virus, you may be invited to have further tests to take a closer look at your cervix. It's very important that you attend for this. Screening catches cervical cancer early, which means that treatment is often easier and more successful. Please book an appointment with your GP if your appointment is due. Please contact your GP urgently if you have unusual discharge, pain during sex, or unusual bleeding, as these could be symptoms of cervical cancer. For more information, you can speak to your GP practice or visit the NHS website or Joe's Trust website, a charity which specialises in providing information on cervical screening and cervical cancer. Thank you.